So that is the picture from Alberta. Now let's look at the national picture, and it is stunning. This country is on track to record the highest number of daily COVID cases ever just in the next month. More than 15,000 new daily COVID cases by the beginning of October. That is if vaccination rates do not increase fast and if steps aren't taken to slow the spread. Canada's Chief Public Health Officer took particular aim at people 18 to 39, saying it is urgent to boost vaccination numbers in that age group.
Where there are pockets of under-vaccinated people, there is an ongoing risk of rapid community spread, high numbers of hospitalization, and potential for emergence of new variants of concern.
So let's go now to Dr. Katharine Smart, the president of the Canadian Medical Association, and she is in Whitehorse. Dr. Smart, I am struck by the modeling because when you look at it, the line just goes straight up in the air. What do you think needs to happen to mitigate the numbers of new COVID cases?
So we know what the tools are. We need to increase vaccination rates. We need them above 85 to 90%. Higher is better. We need to keep up with our public health measures, masking indoors, improving ventilation in schools, trying to limit social contacts as much as we can. So these are really the core things that all line up together to increase protection.
And you're in the Yukon Territory that has some of the highest vaccination rates in the country. But nationally, we are still looking at just 3 out of 4 Canadians being fully vaccinated. What are the kinds of things that you think are necessary? And I ask you on a day when Alberta is now offering, Premier Kenney announcing $100 if people will go and get a first or second vaccine.
Yes, I think this is absolutely one of the challenges is how do we reach that 20% of Canadians that still seem hesitant about vaccination? So I think there's a few elements. One, we need to make sure all the structural barriers are dealt with. So reaching people where they are, going into pockets of communities where the rates of vaccination are low and reaching out to people directly. I think that's really important. We need to Oh, sorry, go ahead.
No, I was just going to say, is it really still a question of getting vaccine to the people, or is it more a question of convincing people that this is imperative for the good of everyone around them?
I think it's some of both. We do see communities where there is increased hesitancy and perhaps some barriers to accessing vaccines. So certainly we're not in that situation where we don't have vaccine for everybody, but we know that sometimes targeting people directly, going into their communities, talking to them can be very effective. So that's, I think, a really important step. But there's no question we also have to be battling the misinformation that's out there and that's driving, so many people potentially away from vaccination.
Yeah, I can hear the dog in the background. We're going to let that go. Everybody's got to keep doing their job here, and that's the dog's job, is to make sure everything's going on is okay. Ontario now, Dr. Smart, the latest province to announce a vaccine passport program. And since that announcement was made, the first dose vaccination bookings actually went up. Do you think that introducing vaccine passports is an important tool to increase vaccine uptake?
Absolutely. We've seen that across the country. There's no question that all the provinces that have gone in that direction have seen a massive uptick in vaccination, where other provinces that haven't have seen their levels of vaccination level off. So I think there's no question that that is one of the tools that's very important in terms of promoting people to get out there and get their shots.
Who is going to be hit in this fourth wave if we don't see vaccinations go up or take additional measures to try to control what's happening?
Well, I think, anyone who's unvaccinated is really at high risk of contracting the Delta variant. It's that contagious. It's ripping rapidly through groups of people, vulnerable people who have been vaccinated, but then are maybe still susceptible. Our elderly, we're seeing that as well. Children, especially kids under 12 who can't yet be vaccinated, it's going to impact them in their school year. So we have pockets of people that are especially vulnerable. And, at the end of the day, it's going to impact all of us as hospitals become overwhelmed. And again, we're faced with shutdowns in that regard in the healthcare system itself.
Can I ask you about some of the scenes that we've been seeing outside hospitals, healthcare centers in many parts of the country? I'm actually just going to play for the audience. Here's some of the protests that we've been seeing. So, this taking place in British Columbia that saw many, many different protests, ambulances just barely able to get through. We heard from a doctor in British Columbia that, women in labor were having to walk blocks just to get into the hospital, that people who have dementia are on the wards and scared by the honking and the yelling, that people are feeling that it's a barrier. Those are the patients. And then there's the healthcare workers, some of whom are getting spat on, yelled at, confronted, physically assaulted, at least in British Columbia. And certainly there has been tension at the very least in other parts of this country. When you see that, when you hear that, what do you think about with healthcare workers who are in these jobs?
Well, it's just devastating for the people that have been spending the last 18 months of their lives, serving the public. I've heard from colleagues all across the country just how devastating those protests were for them on Wednesday. They're inside of those hospitals working hard to serve their patients, and to see that type of hatred and bullying being spewed at them, I think was really, really disheartening. And then, as you mentioned, also patients being impacted by it. Stories of people leaving the hospital after a day of chemotherapy, having an unmasked and unvaccinated person yelling at them. I mean, this type of behavior is just really not acceptable in any context.
Now, there is the right to protest in this country, but when you are getting in somebody's face like that, when you are surrounding a hospital, what would you like to see have happen?
Absolutely, people can protest, but I would encourage people to take their protests to the places where these decisions are actually being made, which is not at hospitals. And certainly, I don't think people have the right to impede people accessing care at hospitals, which is what we were seeing on Wednesday. So, I think, yes, raise your concerns with your elected officials, but remember, healthcare workers are there to serve you.
Dr. Smart, thank you very much for your time. Have a good long weekend.
Thank you.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.